Awesome. It looks like we have everyone here and we are good to get started. So first of all, thank you everyone for joining Congressman DeFazio's virtual roundtable today. Today we'll be discussing protecting affordable healthcare. We'll start with remarks from the Congressman and then move on to introductions from our roundtable participants, and then turn to our roundtable discussion. Following that discussion, we'll have a Q&A where reporters may ask questions to either the participants or the Congressman. So I will now turn to Congressman DeFazio for his opening remarks. Congressman.
Well, thanks, King. Here we are in the virtual COVID world. I was just talking to the participants. This would be so much better if we could be sitting around a table and talking about this issue, which is very serious, which is the way I've done many of these things in the past. But this is a new reality. And the reality is we're in the midst of a pandemic, over 220,000 deaths. Cases are spiking all across America. Oregon's doing better than a lot, but we're going up too. This is a very serious disease and a very serious time. Many people have lost their jobs and consequently have lost their health insurance. There's been a huge increase in the number of people on the Oregon Health Plan. And if we pass the HEROES bill, there will be other assistance to provide health care to people who've lost it because of the pandemic. But campaigns should be about issues, not pejoratives and or made up stuff. It should be about, well, what are you going to do? This is a pretty serious job. How are you going to vote when you get there? Okay, so that's why we're here today. My opponent has said he is against government-run healthcare. Now that's a pretty global, declaration. Now he said, oh, well, he didn't mean Medicare, Medicaid, and veterans. Well, he said he's against government healthcare, and those are all government programs, by the way. I remember when we were doing the ACA, and I actually had those people come on who would say, hey, tell the government to keep its hands off my Medicare. Well, it is a government program. He then came out for repeal of the Affordable Care Act, which has been a Republican mantra for a decade. The House, when the Republicans controlled the House for 8 years, I believe we had close to 70 votes on repealing the Affordable Health Care. And the mantra always was repeal and replace. There were no votes to replace. There is no replace. They've had 10 years to come up with a replace. No replace. And then we have President Trump. He ran on repealing the Affordable Health Care Act. And the president said, well, I'll have something better, much better, much better. It'll be fabulous. Everybody will have better insurance and it'll cost less. Well, he's had 4 years in the White House and there's no plan. And now, I have a young opponent who says he's with Donald Trump and he's with the Republican majority in Congress. Well, here's the deal. The Supreme Court is going to vote on overturning the Affordable Health Care Act probably by the end of November. And given the new appointment and previous decisions, it appears they will overturn the Affordable Health Care Act. And there is no immediate replacement. Congress can replace the Health Care Act with something even better. I was a reluctant vote for it because it was the Senate version. The House version was infinitely better. We had national exchanges, which would have meant way less expensive policies. It had my amendment to take away the antitrust immunity of the health insurance industry, which, by the way, I passed again in this Congress with a unanimous vote just about a month ago. All the Republicans even voted for that. Because a Consumer Report says that would save consumers billions of dollars a year in premium costs. Those things were in the House version. We had to take the Senate version because Teddy Kennedy died and the Senate has this stupid filibuster. And we weren't allowed to amend it, change it, improve it in any way. So from day one, it needed a lot of work. But instead of working on making it better, the Republicans, when they took over, worked on making it worse. And now finally, they're going to have their day in court to totally repeal it, since they could never, even though they controlled the House, the White House, and the Senate, they couldn't quite get to voting to repeal it because they didn't have anything to replace it with. We're going to hear from some people today who will talk about what it means to have the Affordable Health Care Act in place. In my district, it's pretty specific if it's repealed. 73,000 people immediately lose their Oregon health plan. They are supported under the Affordable Care Act. The state can't pick them up. Some people don't remember, before we had the Affordable Health Care Act in Oregon, if you were Medicaid eligible, which is what the Oregon health plan is, if you met all of the statistics, very low income need, you were put into a lottery to see whether or not you could get on the plan. And every year, tens of thousands of people were not allowed to get on the plan because they didn't win the lottery. We don't have lotteries anymore. And people are on the plan. It's a solid plan. It's good coverage. 73,000 people in my district, 270,000 statewide, immediately lose all their health insurance, all their health insurance. And then we have in my district well over 300,000 people who the insurance industry says have pre-existing conditions. And before the Affordable Health Care Act, they could refuse to sell you a policy because you had a pre-existing condition. They could exclude your pre-existing condition from coverage under their policy. They could charge you an absolutely extortionate premium because you had a pre-existing condition. That doesn't happen anymore because of the Affordable Health Care Act, but that goes away for more than 300,000 people, including 36,000 kids, the day the act is repealed. And then finally, there was something called, Medicare Part D was again written by a Republican Congress. It was, and it's better than nothing, but we could have had a much better prescription drug program for seniors. But it's absolutely a lifeline for many, many, many seniors. And I have one of the highest concentrations of people on Medicare Part D in my district in the country. 155,000 people in my district are on Medicare Part D for prescription drug coverage. Before the Affordable Care Act, you had a copay, but then when you got to $2,000 of expenses, you fell into something called the donut hole. And for the next $2,400, $2,400, you had to pay 100%. And then when you finally climbed out of the donut hole, after $4,400 of prescription drug costs, you would again get to pay copays and have coverage. The Affordable Care Act did away with the donut hole. So that would subject 155,000 people to copays and a premium, an extra cost of $2,400 next year. I don't know a lot of people on Medicare Part D who can afford another $2,400 a year for their insurance. That's what's at stake. This is deadly serious. So with that, I'd like to move on to our panelists who can actually put some real facts and real live situations on this.
Absolutely. Thank you, Congressman. I'll now turn to our panel today for their introductions and for a chance for them to tell us about themselves. We'll start with Donna Courtney.
Hello. I am an RN care manager, and I had the opportunity to work in private and Oregon Health Plan insurance companies for over a decade. I had the opportunity to do underwriting and to see the worst of pre-existing. So I feel honored to be a part of the panel. Today, I am a small business owner and still support seniors in Oregon. I am part of the Governor's Commission for Senior Services and Lane Senior Support Coalition, that we raise money for costs that are not covered under Oregon Health Plan or Medicaid benefits. Thank you.
Thank you, Donna. We'll now turn to Chris Jennings for their introduction.
Hi, I'm Chris Jennings. Thank you very much for having me today. I really appreciate the opportunity. I am a Social Security recipient. I'm retired. I'm 66 years old. I used to work in the medical profession as a surgery scheduler at Riverbend. I do receive quite a bit of help through the Medicaid expansion for Medicare recipients, and I believe that the repeal of the the ACA will be detrimental to not only to myself, but to many other people countrywide.
Thank you, Chris. Timothy Morris, if you would like to introduce yourself.
Hi, good morning, or good afternoon, excuse me. My name is Timothy Morris. I live in Eugene, Oregon, and I'm one of the people covered by the expanded Medicaid under Oregon Health Plan. And only until recently, when I lost my job. And now I'm really reliant on the Oregon Health Plan to continue my success in my health.
Thank you, Timothy. And finally, Donna Roberts. Are you there, Donna?
Yeah, I'm right here. Can you hear me?
Yes, if
Yep.
you want to introduce yourself.
Okay. My name's Donna Willoughby Roberts, and I'm a person of a pre-existing condition of a kidney disease. I'm a part-time faculty for 18 years at Lane Community College, and I've been really fortunate to have and keep the insurance there throughout all of the ups and downs that I've been going through. I'm currently on dialysis. I have Medicare Part B, and on the transplant list.
Thank you, Donna, and thank you everyone for joining us today again. We'll now turn to Congressman DeFazio for our roundtable discussion and for questions for our panel.
Yeah, well, thanks everybody. I know it's not easy to to go public and talk about concerns and problems you have, and I really, really appreciate your willingness to do this. With the pandemic raging, there's quite a few people, and we've seen stories. There was one in the Guard. It was very, very touching about a young woman who'd been a marathon runner and now can't even walk up a flight of stairs 5 months later after having had COVID. And many other people have long-term impacts. So it's quite likely that insurance companies will consider anything that they could relate to COVID as a pre-existing condition. And I mean, I'd like to have like Chris and Tim answer what it would mean if suddenly, let's just say they had COVID and they, later couldn't keep their health care or anything related, or the insurance company deemed related to that was not covered. What would that mean? How would you deal with that?
Well, for me, I already have a pre-existing condition. I was hospitalized this June for multiple blood clots in my lungs. And I was tested for COVID at that time, and I was negative and admitted to the hospital for 4 days. I am very careful not to catch COVID. I social distance. I don't go out much. I wear a mask if I do have to go out for any reason. And to lose any kind of coverage that I have, I really don't know how I would be able to pay for it. I'm a Social Security recipient, as I said, and I make less than $1,200 a month on Social Security. So the Medicaid expansion and my drug coverage has really helped me. One of the medications I was on for my blood clots cost $485 for a 1 month supply. But with the help I get through the Medicaid expansion from the ACA, I only paid $8.95 per month for that. So now that I don't have that problem, but if you get something else or if you get COVID, costs are really out of control for people. And if you don't have some help and you don't have savings or a good job or a retirement plan, then you're just kind of out of luck.
Yeah. Tim?
Yeah. Yeah, if I can follow up with that, I even before the pandemic hit, my mom was someone who got really sick, and I watched her navigate through before the Affordable Care Act, through the Affordable Care Act, and it's a night and day kind of difference of, the staying up in the middle of the night and sitting at the kitchen table wondering what bills we're not going to pay so that we can pay for medications or treatments or things like that. But you know, even with all of the Affordable Care Act and with all of that support, I still saw my family get shouldered with massive amounts of medical debt. And you know, if my mom was still alive today, she would be someone who would have a pre-existing condition. And with things like COVID, my family would be under an even more enormous medical debt and would not be able to survive. And I know that that's something that I would have to face as well. Is if, you know, my dad were to pass away, where does that medical debt go? It goes to, you know, my brothers and I, and we're the ones paying that off. And that's a real rough legacy to leave, you know, your family. And that's actually a conversation that my mom had with our family before she passed away, is that's not what she wanted to leave behind. And so, you know, the Affordable Care Act, and for me, OHP really gives me a peace of mind that, like, I mean, even earlier this morning, I almost slipped in the shower and I thought about it, like, this could be the day that everything goes downhill, you know, it's a real rough life before your eyes kind of moment. And, you know, if it wasn't for OHP, that fear would have been that my life would be forever changed because of debt and because of medical bills.
Yeah, that, you know, there's two great points there I want to follow up on. I mean, what Chris raised is the exorbitant price of pharmaceuticals. You know, every other major government on earth negotiates lower drug prices for all their citizens with the pharmaceutical industry. That's why you can buy the identical drug in Canada for sometimes 20% or 10% of the price here in the United States of America. The Republicans in the Medicare Part D bill prohibited the government from negotiating lower drug prices. We do it for veterans. We get huge discounts. We do it for Medicaid, and we get discounts. We should be doing it for everybody, but that would be government interference in the free market in healthcare, which of course my opponent and the Republicans generally are against. And then what Tim raised about debt, one of my best friends was the chief financial officer at the old McKenzie Willamette before it became a corporation. And, you know, it was a community hospital and they tried to be really good to people, but they, you know, they couldn't run without revenue. And one day I was talking to him and he says, you know, I'm quitting my job. And I said, Steve, why are you quitting your job? You know, you love working there. He says, I'm tired of taking away people's houses. That's what the end result of those run-up bills would be for many people. And that doesn't happen anymore with the out-of-pocket limits and everything with the Affordable Care Act. Let's then move on to, you know, what happens if the Supreme Court, after the November 8th hearing, you know, repeals the Affordable Care Act in its entirety. As I said before, I mean, 72,000 people in my district on the extended Medicaid Oregon health plan would immediately lose all coverage. And I mean, what it would mean to your family or the people that you work with. Donna, perhaps you'd answer first, then Tim.
What it would mean to my family, we are not quite on the transplant list for one of our children, and I have a disabled grandchild, and I'm also a healthcare representative for my brother that is very disabled. The impact of the Affordable Care Act going away would be catastrophic. And we would try to step up the best we could with our resources to help. But knowing how pre-existing works and no insurance before Oregon Health Plan, I know how ugly it is. I was an exceptional needs case manager for Oregon Health Plan at its inception. And I was so thrilled to be a part of that program because finally people had really good insurance that really we could help them with. And if it goes away, it's going to have a huge impact for not only the people on the plan, but all of their families and their loved ones trying to figure out how to meet their needs. I can't believe people don't understand the impact of the Affordable Health Care Act going away.
Thanks, thanks, Donna. Tim, did you want to chime in on that?
Yeah. You know, my as I mentioned before, my family has received a lot of medical debt, and you know, just to kind of sum up where my thinking is in kind of a story is that during this pandemic, I ran out of my prescription medications and had to order more, and it's the first time I've done anything with the Affordable Health Care Plan, and I was very nervous. I didn't know what was going to happen. You know, I didn't know what to expect. I walked in, said my name, he handed me my medication and said, "Have a great day." And that was it. It was very simple, very streamlined. There was no gambling, no negotiations, no wondering if something's going to cost $10 or $50,000. I think, you know, it's not only a peace of mind for me if something goes wrong, it's a peace of mind knowing that, you know, I'm covered, I'm taken care of. And if that's stripped away, you know, especially during COVID-19, especially during a pandemic like this, that's a peace of mind that we simply can't afford to lose.
Yeah, I that reminded me of before the ACA. I was visiting a pharmacy in Roseburg area, and I was talking to the pharmacist, and he said, you know, just sad. He said these older couples come in, and they come up and they say, "How much are our prescriptions this month?" Because they go up almost every month, even though it's the same drug. There's no new research or development involved. And he says, then they'll go over and sit on that bench over there. And he pointed and he says, and they'll have a discussion and they'll figure out which one of them can afford their medications this month or which medications they can afford. And then they come back up and they can't get them all. You know, that doesn't happen anymore, but it will happen again. And then, you know, I mean, anybody can chime in on this. You know, if, you know, just thinking of the potential consequences given your various circumstances, if suddenly, you know, the support is gone under the ACA on pre-existing conditions, on, you know, on prescription drugs, and, you know, on, you know, just your insurance goes away altogether. I mean, do any of you, and anybody can jump in on this, think you could just afford to go out and buy a private policy and get by? Chris or Tim?
Well, I also, besides getting the wonderful benefit from my prescriptions, generics are $3.19 and non-generics are $8.95. The ACA also pays my premium for Medicare every month. So I don't have that cost. I believe it's $144 or $148. I also have no copays for any preventative PCP visits, and I only have a $40 copay when I go to see a specialist. So no, on $1,200 a month, I don't know. I really don't know at this point what I would be able to do.
Yeah, to really directly answer your question, if my own financial situation would be thrown through 100 different loops. I lost my job back in March. I furloughed in March. I lost my job back in May because of COVID-19. And since then, it's just been a balancing act of what bills I can pay, what bills I can kind of put off for the month, what I can renegotiate or change down the road. And I think if I lose my healthcare coverage, you know, I've talked about losing my peace of mind, but I would lose so much more as well. I'd lose access to prescription drugs. I'd lose access to being able to see a doctor for just a checkup, you know, everything like that. And I think, you know, one of the big negotiations that I've done already is those sleepless nights where I'm staring up at the ceiling and wondering if you know, I paid off my car years ago and wondering if I should sell my car now to be able to afford to pay rent or something like that, or if I lose my healthcare coverage, affording my prescription drugs. You know, if I should sell my car or if I should keep it, because that's where I'm going to be sleeping when I lose my home. And so that's the fight that I have with losing my healthcare coverage, losing my, you know, everything like that is those very difficult sleepless nights wondering what if.
Well,
I was going to
Yeah.
say something too.
Sure. Go ahead.
Have a ton of medications that I'm taking right now, and I'm doing dialysis, and I got a dialysis bill for $3,700 that, thank God, I don't have to pay between my Medicare Part B and my private insurance, and the fact that my pre-existing condition is covered right now. Both my husband and I are near retirement, and so I'm worried about the healthcare being pulled away and the pre-existing being pulled away right at a time when we're about to retire and our income's going to go down.
Wow.
Yeah.
Well, I mentioned earlier that 155,000 seniors would be subject again to the donut hole. That's co-pays plus $2,400, and then co-pays on your prescriptions after that. You know, and I mean, Chris, from your work, when you were working on these issues, and particularly with seniors, I mean, what do you think that what would that mean to the 155,000 people in my district?
It's kind of unbelievable to me that this is even happening. And just as an example, I have a sister who is not a Democrat and was not didn't believe in Obamacare, as she called it, instead of the ACA. And she, through Medicaid expansion, she was able to get on the Oregon Health Plan after not having insurance for many, many years. And she was bragging to me how happy she was that she was able to finally have health insurance. And I said, do you know how you got that insurance? And she said, what's Oregon Health Plan? And I said, yes, but you got on Oregon Health Plan because of the ACA, and that was through the Democrats and through President Obama. And she was just shocked. She didn't even realize that her availability to have health care after many years of having nothing came through a politics that she didn't even believe in. So I think that's just kind of astounding to me. And then I really don't know what people are going to do, and people should not have to make a choice. And I luckily have family that I know would help me, but still my 4-day stay in the hospital was $35,000. And, you know, I know Medicare would pay part of that, but I would still be on the hook for the part that didn't happen. And that didn't include the medication for after, and that didn't include all the doctors and specialists that came in to see me while I was in the hospital. That was just the hospital bill. There was probably $9,000 or $10,000 more just from the doctors that came in to care for me.
Yeah, well, I don't think there's very many people that I represent in this district who could afford a $45,000 healthcare bill. That would just be beyond most people's capability and put them in severe financial distress. The greatest cause of bankruptcy before the ACA was uninsured health emergencies. That doesn't happen anymore, but we could go back to those days, which would be very, very, very sad. Just two more real quick questions so we can see if any of the press have answers. I mean, if Donna and Donna could both talk about what would happen if pre-existing coverage was stripped away. I mean, they're either going to say you have no coverage for that condition, or they're going to say, well, here's your new premium, or they're just going to deny you a policy altogether, which they're free to do under, especially with antitrust immunity.
Well, I'd like to relay an experience I had before the ACA. Many of the people I know would reach out to me because I had the background in insurance. And I had a friend that had a ranch in Eastern Oregon who developed a very significant cancer diagnosis. They were looking at either divorcing her and her husband, and they had a young child, or they were afraid of losing the ranch because they could not afford health insurance. At that time, the state of Oregon had a program called OMIP, the Oregon Medical Insurance Pool. It was very expensive. There was still large copays. They had something. But I don't want people to have to go through that again, that they can't even imagine what pre-existing means for people that have a weight issue or pre-diabetic, osteoporosis. Insurance companies have the opportunity to deny anyone on any reason. And what I would find is that they would get the doctor's notes from the person's visits with their doctor. There would be things in the notes that the patient didn't even know was there. And they could be denied for something they didn't even know about. So to go back to those days would really be just so catastrophic. And I think people just simply don't realize what that looks like.
Yeah, in my situation, my father had this kidney disease, so a generation before me, when they didn't have the pre-existing condition protection that I have now. And I remember that my father withheld information from us about his disease because he didn't want us to have to lie to the insurance companies that we might have it. So that's kind of an interesting story. I have two other brothers, so he withheld that information. And then once the clause was under protection, you know, he could be forthright with us about his situation.
Wow, that's an incredible story.
Mm-hmm.
I mean, there's so many stories like that. Okay, final quick close. You know, for everybody, just that is healthcare, you know, and the continuation or even the continuation and improvement of health insurance coverage high priority for you in this election? King, you can call on them one by one if you want.
First, we'll start with Chris.
Yes, I do believe that healthcare is it's so important, and like I said before, it's unbelievable to me that we're at this point, that the Republicans have decided to do this, not just to Oregonians and to myself, but to the entire country. And I sincerely hope that the Supreme Court is able to see that this is not the way forward for our country.
Thank you, Chris. Moving on to Tim.
Healthcare is one of the top issues for me. And I mentioned it before, but my mom was sick, and part of her last month on this earth before she passed away, she talked about, you know, what medical debt could do to the family and what kind of legacy that leaves behind. And that is such a horrifying conversation to have. It's heartbreaking. And so, you know, across the country, that's a conversation that continues to happen over and over. And it's such a basic and necessary right. So healthcare is one of the top issues for me. And I always look to candidates and measures that talk about it. And that's who I support, is who supports healthcare.
Thank you, Tim. Donna Roberts.
Yeah, definitely the way that I vote depends a lot on what people's policies are on healthcare right now. And my whole world is kind of wrapped around healthcare. And I have so many friends who have pre-existing conditions. So I worry about myself and my friends my age that have problems, and it's just huge. And it's just a shame that people have to worry so much about healthcare right now.
Thank you, Donna. And finally, Donna Courtney.
You know, it appears that we're looking at a second wave of COVID. And of all the times for there to be a consideration of dropping the ACA, I can't even imagine it. Our healthcare system, I'm here in Lane County in Eugene, the COVID has put the healthcare system in a place of chaos. Even before COVID-19, it's very difficult to get a doctor in Eugene. And the specialists, it's even more complex to try to find a physician in a timely fashion to possibly do a diagnosis. To drop the ACA right now in this time of COVID, where we don't even know, are there going to be strokes? Is COVID going to cause dementia, heart attacks? All of the things they're learning about COVID. And to drop the ACA, to put that financial piece in chaos, it's just unthinkable to me. Of all the times to consider dropping the ACA is now. It just adds fear and panic to an already difficult situation in our pandemic. So I'm really hopeful that we can get the information out about how complex this is for even considering dropping it.
Well, thanks everybody. Again, I know it's not easy to talk about, personal circumstance, family circumstance, things like that, but we have to put a face on this. Otherwise it becomes, it's mostly been shuffled aside during this campaign. I think two critical things we need to do is, if the Supreme Court overturns ACA, we need to replace it with something even better. I would, start with the first House bill and even go beyond that. So then the second thing is we need another COVID relief package, and that's, we're going to fall off the edge of the economy here pretty soon, with all the people who have had their rent forestalled, but they're going to get a big bill and they're not going to be able to pay it if we don't get rental assistance. We're going to see extended unemployment expire for millions of people on January 1st. If we don't extend it, 108,000 people who worked in small businesses in my district got paycheck protection. And all those things have expired and need to be extended in addition to health insurance. And it's just a fact. It is negative, because it's stupid. My opponent says no more COVID relief. He's in there with Ted Cruz, who is almost single-handedly blocking any additional COVID relief in the Senate. And he's in there with all the rest of the party and saying, well, we're going to repeal ACA, but don't worry, we'll come up with something later. Well, how much later? Day after, week after, month after, year after, when? And what's going to happen to all those people in that interim period? That's an issue. And too much of this campaign and other campaigns around this country have not been on issues critical to the American people. Well, this is one that is critical to the American people. With that, King, if there's anyone who has a question for any of the panelists or me, be happy to move on to that.
Thank you, Congressman, and thank you again to our panelists today. I will turn to Katrina regarding any press questions. Do we have any questions from reporters out there?
Hi, this is Katrina. Do we have any questions from the press? If you have a question, please let me know and I'll go ahead and unmute you. It looks like we are going to turn to Taylor Purse from Eugene Weekly for a question.
Hello, can you hear me?
Yes.
Okay, so my question is, since the Supreme Court is now stacked, against the ACA, and that looks like the way that they might be voting, what are sort of these next steps for the everyday person who might be facing losing their health care? Is there any other sort of resources they can look to at this time?
Taylor, I wish I could say the state will pick up the tab and keep them on expanded Medicaid, but the state of Oregon is already $1 billion in deficit for the next biennium. I don't think they're going to be able to do that. I don't, right now, there is no immediate fix. I mean, I'm certain we could pass a fix, very quickly in the House. But again, I mean, we have done things to improve the Affordable Care Act in the House in this Congress. We've passed 5 COVID relief packages, 3 of which became law, and 1 of which is, still being negotiated. But the Senate is a roadblock. So I fear that we would be waiting until potentially the Biden presidency to get, and a Democratic Senate to get restoration or improvement of healthcare for people who totally lost it because of this. That's a long time to go without health insurance. That's 2 and more than 2.5 months. And if you've got a pre-existing condition and you need medications, if you have a health emergency in that time period, you're going to have to be looking for, essentially asking the Peace Health or the McKenzie Willamette, whatever corporation owns them now, you go there for emergency care, and then you'll just be getting the bills.
Thank you, Congressman. It looks like we have another question from Jeff Mapes from OPB. So we'll turn to you, Jeff.
Hi, thanks for taking my question. Congressman, you said that too much of this campaign and others has not dealt with issues like this. What's been your fear about how too much of this campaign has gone? In other words, what's it focused on that you think's misplaced?
Well, I don't think we're focusing on things that are absolutely critical to Americans. I mean, I think the Democrats lost, the presidency in the last election because they didn't think that Hillary Clinton was addressing their real needs and understood the real needs of struggling American families. And Donald Trump spoke to those people, but he, in terms of health care, he wants to repeal the Affordable Health Care Act. In terms of tax cuts, 80% of the benefits went to people who earn over $400,000 a year. The things that those people need the most, are not being meaningfully discussed in this election. How are we going to improve or continue your health insurance? How are we going to help you during this time of COVID? The 10 million people are unemployed when their extended federal unemployment starts to expire. How are we going to help you if you're one of the many millions of people who has had rent forbearance or mortgage forbearance when January 1st rolls around and you're not getting any help for the very large bill you're going to suddenly receive? Or even for those few companies, and not very many of them did it, who stopped collecting Social Security tax from their employees. All those employees get a big bill on January 1st. The tax didn't go away. Donald Trump just skated on it until after the election, and they're going to get a bill from the Treasury. And so those are going to be really, really critical issues to people. A COVID relief package, including those sorts of things. Restoration of health care if the Supreme Court takes it away. Those are things that are life and death, or housed or unhoused for many, many Americans. And they are not being discussed. They're certainly not being discussed by my opponent. And in watching, presidential issues, I don't see much coming out of, Donald Trump on that, and the many campaigns across the country.
Okay, next up we have a question from Jeff Manning with the Oregonian.
Hey, Congressman, you were throwing a lot of numbers at us early on. I heard 270,000. I heard 70,000. Can you, statewide, how many people are we talking about? I thought it was closer to 400 than 270.
Well, I know it's 73,000 in my district. My staff can correct me. I thought it was, just shy of 300,000 statewide. If it's 400,000, that's even worse. But that would be more than 5 times my district. And my district has only Greg Walden's district has more people on expanded Medicaid than my district.
Okay.
So I'm not sure it would be that big a factor. Can someone King or somebody quickly answer that fact? Bobby just sent it to me. 372,000 statewide with Lewis Insurance. So you are, I was off by 100,000.
Okay. Let me ask you to look into the crystal ball. If Biden wins and the Supreme Court strikes it down, how long realistically before something new could be passed into law?
Well, you've got to hope that there is some shred of compassion in this Supreme Court. They could decide that the law was, however they're going to decide it, unconstitutional. They could stay their decision until there's an opportunity for Congress to act. That would be totally within their discretion. And I would hope that they would. And I hope that they would give us till, I would say, I imagine we could do something within a month of inauguration. That depends upon the Senate. If it's still Mitch McConnell's Senate, I don't know how long it'll take. But I would start with the original House bill and build on it. And that could be a good interim solution that could be adopted quite immediately. Again, the House bill was so far superior to the Senate bill, but we couldn't negotiate because Bobby Kennedy died, and they had to pass because of the filibuster, which I hope also goes away if the Democrats take over, and Jeff Merkley's leading the fight on that, and that has to go so we can get things done that the American people need. And without the filibuster, we could have negotiated between the rather poor Senate version of the ACA and the much better House version of the ACA, and had a way better program from the beginning, way less expensive for individuals, and taking away antitrust immunity from the health insurance industry, which again, I just passed unanimously in the House. So that's probably something we could even get through Mitch McConnell's Senate if it'd bring it up for a vote.
Okay, we're going to take our last question from George Henry from Coast Radio. George?
Yes, can you hear me all right?
Yep.
We can hear you.
This is obviously a multi-pronged problem in healthcare altogether, not just the Affordable Care Act. There are those who, through the Oregon Health Plan, were able to be helped through this that may have been financially struggling. Those who are in the position that can afford their own health care saw their health care go up 3 to 4 times what their payments were prior to ACA. Is there a fix that can be done and still maintain the ACA, or does this have to be reworked at some point?
No, absolutely. If the House bill had passed, which had a national not-for-profit government plan, they wouldn't be paying those extortionate premiums. And if the House provision to take away antitrust immunity from the colluding insurance companies had passed, they couldn't have jacked up the premiums that much. State insurance commissions are pretty weak around the country, including here in Oregon. They can't really exert any leverage on the industry. But if we took away their antitrust immunity, both the feds and the states could go after them for colluding to drive up prices. That would change things very rapidly. So those two things alone would have dramatically lowered the costs. I mean, imagine instead of a state by state, a plan, and to have a national not-for-profit government plan, something like Medicare, but better, for everybody to buy into, I think pretty soon you would find that that there weren't many people buying the private insurance anymore. They'd say, hey, this has better benefits and it's cheaper. And that could be done quite quickly. They still get choice. If they want to go to the Blue Crosses and pay more and get less coverage, have at it.
Thank you, Congressman. And thank you again to everyone for joining our virtual roundtable today. We will cap out with closing remarks from Congressman DeFazio.
Well, I think we're pretty well close it out. I want to thank the panelists again for sharing and really shining a light on what an incredibly serious issue this is and should be in this election, being glossed over by some. Including my opponent, who says, well, repeal and I'll give you something better later. Well, if the Republican Party can't figure it out and Donald Trump's administration can't figure it out, I'm not quite certain how Mr. Scarlatos is going to do that all by himself. You know, that's about all I have to say. It's a critical election for many, many, many reasons. Everybody should vote.
Great. Thank you, Congressman DeFazio, and thank you again to everyone else. Have a great day.